The heart is, in Tibetan medicine, is king of the organ system. That means heart is the governor of the blood and the fluids. But there's another, like the hiding meaning about the heart. We are talking about like a lot of the disease which is related to the heart disease. There are a lot of the emotional problems like stress, anxiety, and depression is connected to the heart disease. And in Tibetan medicine, we talk like three different types of the body systems. One is the gross body. We're talking about like the heart organ. And the second is the subtle body. We're talking about the channel and the chakra systems. That is like energetic circulation in our internal of our body. And the third, very subtle body, is that's like it's hard to understand, but that's it's a dynamic power of our body systems. It is our mind, the subtle energy, the subtle wind, and the subtle mind. That's where when we're talking about the heart disease, why it's connected to the emotions. That means like it's connected when we talk the three humor theories in Tibetan medicine. There are each 5 types of total 15 types of the three humors, and the 3 types of the three humor which located inside our heart. For example, one is the pervasive wind. The pervasive wind which is located inside our heart. That means like in the modern scientific medicine, heart is like circulation, pumping the blood, and it's increased the circulation and assistant the circulation. And Tibetan medicine, that is the one function of the pervasive wind. There's another one type of wind which is located inside our brain. And Tibetan medicine, our brain is the ocean of the nervous systems, which is in the modern scientific medicine. They are talking about like a pituitary gland and a lot of things which connected to our brain. Then we talk about like the brain also like there's located the life-sustaining wind which is located inside of our brain. That means like open our sense organs. That's why we talk. There another one is the flame in Tibetan medicine, the wind, flame, and bile. Flame is one type of flame is located inside around our chest. That means like a heart governs the blood and fluids. It means like that's the power of one type of flame. Then why is connected our heart's connected the emotions? And Tibetan medicine, when we're talking about the chakra systems of our body, one we are say like the clear or memory functions. That part of the chakra systems is located in our heart chakra, and once another chakra system is located inside our brain. That means like clear or sense organs, and that is located in our brain. When you meet a lot of the cardiovascular patients come to see if you ask questions, a lot of the patients, they have the different level of the stress and anxiety. That means in Tibetan doctors, the first they diagnose the heart disease, the doctors think the 3 ways. One is like there's kind of like a functional problem in the heart organ, and another one is like the energy circulation, which means the pervasive wind function. Sometimes the deficiency, sometimes it's like exercise. And another one is the coronary artery disease. A lot of like the heart problems, there's like a lot of the blood fat and like the engineer in Western terms. That's kind of the disease we divide like, it's connected to the flame. That's why the flame, we try to like give the lifestyle and the dietary instructions, and we try to give treatments that's most focused on the digestion. We are stimulating the digesting and try to smooth through the blood circulation inside of the brain and inside of the internal body systems. That's why the Tibetan doctors diagnose the three different ways to the heart disease. But a lot of the Western the diagnosis and the types of the heart disease, which means like coronary artery disease, we focus on the phlegm and wind, try to move the phlegm and the fluid very smoothly. That means like we focus on the digestion. Why we focus on the digestion? Because like all internal organ systems, all internal organ disease comes from the digestion problem. That's why we focus on and give the medicine to strengthen the digestion and dry the fluids from and cleansing the blood. That's the one. It's principle of the treatment. That's why in Tibetan medicine we not only focus on the heart organ, we focus on the energetic circulation, and we try to give lifestyle instructions to the patients, reduce the stress, anxiety, and the depression, all the emotional signs and symptoms. And later on, I would like to share some ideas about the Tibetan medicine, how to give treatment, the treatment principles, and which I mentioned about the body systems in Tibetan medicine, the 3 types of body systems. That means like in Tibetan medicine, we are not only giving the pills and the powders to the patient. That is the one part of the treatment. Another 2 types of the treatment is we give some special like treatment, which means like mantra healing, and we do like we have a lot of treasure, classical like medical books which mention about like the epidemic disease and also the emotional problems. We use some the herbs with mantra healing, do some specific meditation, specific like practice to reduce the problem. And another one, the powerful medicine, and in the Western country, it's very popular, the meditation. And Tibetan medicine, the most powerful meditation, the most powerful medication is the mindfulness, the meditation. That means like in the Tibetan medicine, especially about the emotional problems, like it's hard to control your emotions, we try to give the instructions about who to do the right meditation. That means like the meditation works like the 2 types of nervous systems, the sympathetic and the parasympathetic. It's more used the parasympathetic nervous systems to let the patient the relaxation about the mind, the physically and mentally. And later on, Dr. Pinso Womo, she's going to talk about the more authentic Tibetan ways to give treatment to the heart disease in Tibetan medicine.
Before the Tibetan medicine, in order to treat, first we try to understanding what we're treating, so that the body. So the Tibetan medicine is we talking about the 5 elements. So the 5 element is the fundamental, like the concepts of the Tibetan medicine. So we believe everything, either outer nature, inner nature, everything is composed by these 5 elements. As long as the 5 element is balanced, then we have healthy. And once they imbalanced, either is excess or the deficiency, or they go to the wrong sort of like path, then we have the problem. So in this case, when we say it's like excess, then we try to reduce whatever the excess element. If the deficiency, we try to bring up. So the main point or the goal of the Tibetan treatment is try to be balanced. So that is the main Tibetan medicine treatment. But when we look in the treatment, and basically we have 4 treatments which we can apply. The first is the diet. Second is the behave. Third is the medicinal. And the 4th is the external therapy. So in the Tibetan medicine, we call it men. Men means is not necessarily is pills or powders or this or that. Men means is the benefit. So whatever can benefit to the suffering being, that is the men. So for this reason is when we looking the behave treatment, And then we have like yoga, we have a mantra healing, what the doctor mentioned before. And then also we have a meditation, so on and so forth. As the morning that the Dr. Tudem Punzola clearly mentioned, the Tibetan medicine is not like combined with the religion, it's completely is a scientist. But once we talk about the medicine, men, is the Buddhism teaching, Buddhism knowledge help your condition? It is men, so we use that, we adopted that. So that way it looks like the Tibetan medicine is combined with the Buddhism. Or you can say the Tibetan medicine completely is independent. Either one is fine, because the patient is interested to release the problem. They don't care is which way they're releasing the problem. Either Chinese medicine helping or Western medicine helping or this or that, they don't care. Their only care is how I can release as soon as possible this suffering. So when we're looking at the heart disease, today's our topic. Heart disease is any heart disease, we have cause, condition, and symptoms and the treatment. So before the treatment, first we look in the cause. Because heart disease, not there's only one, not there's only two. There's many different types of the heart disease. So first we look in the cause of the heart disease. So when we do the diagnostics, we say is the first we try to search why we have this. So mainly we try to observe cause of the disease. So which kind of diet they do, which kind of behavior they have, which kind of life circumstance or lifestyle. So this kind of first we try to observe in the lifestyle. So that gives us a cause of the disease. Then we try to observing the symptoms of the disease. So when we look in the heart disease, mainly heart disease sort of like could be is like physical or the mental effect. So then we try to observing the what is the symptom. Symptom what the patient feeling, or the symptom we find through our method, through the diagnostics like pulse reading, urine analysis, checking the eyes, checking the tongue, so on and so forth. So we try to find the symptom. Then we try to find is that which kind of make it better or worse, like effect. So through that way, then we try to come up the treatment. So normally, as the doctor mentioned before, the lung tipper and the pagan, so these three dual, the English they translate, they call it humor. I'm not sure that is exactly responding or not. So anyway, this the three dual is together, always working as like a team together. That way we call it dual. Dual means is something gathered. In order to function this body, this lung tipper pagan need to be together presenting, then work as like a team. One of them missing, or one of them became lazy or too active, and the other two is affected, so then body feels something wrong. So when we're looking the disease, an example we say like a heart attack. So in the Tibetan medicine we call is ningze, pain on the heart. So there is two types of. One is combined with the lung, as the doctor mentioned before, and the one is combined with the blood, also which we mentioned the doctor before. So these two is feeling is basically the same. You have a pain, you have like a tightness here, also numbs the fingers, and they're also causing like short breath, and they're also causing like dizzy and so on and so forth. So makes you run to the hospital emergency, it looks like a heart attack. But when we're looking, then there is two types. Everybody who has the chest pain is not necessarily a heart attack based on the blood. Also, they're caused by the wind, by the lung, which is that the pervading lung. So the pervading lung is not circulating well. Why is not circulating well? because then is something substances not able to digest. So then that also, which the doctor mentioned before, like the digestive system. So the Tibetan medicine, when it comes to the treatment, we are not treating the symptoms. No matter what happened, we try to first understanding the root of the disease. When we look at like poison or IV, if you're cutting just trim the leaves, the root is there, so today cutting and then tomorrow grow up. So that does not help to release the completely sort of like the cause. What we try to do is first we try to find the root of the disease and then try to dig the root. Then hopefully something manifests. But also sometimes it is successfully working and sometimes it's not successfully working. Why? Because it's the cause of the disease. As we mentioned before, there's 4 conditions or 4 cause of the disease, like diet, behavior, provocation, and then the seasonal. So if the provocation involved, then may we need something ritual practice, or we may need to do something else. Also, sometimes there is involved with the karmic disease. So then this kind of is karmic, if that the disease involved with the karmic, then it's not so much things to do also ritual practice or taking medicine that need to pay back, so you need to change in certain your attitude. So those are how we sort of like try to searching or finding the root of the disease, try to digging at the root of the disease. Then when it comes to close to treatment, so treatment is if the disease is minor or the new. New means is you just had 2 days before, 1 week ago, like a disease is new. And then also is that disease is not too serious. What we try to do is we advising to the patient or the person to changing certain lifestyle. So that we believe is enough. Because it's the whatever we eating is medicine. Whatever we're putting in our mouth is medicine. Whatever we're doing, also activity, also is medicine. Like a Tibetan point of view, like a man. But is that our regular food is our body is too used to it with this food. Our body is completely sort of like a friend with this food. Then is normally doesn't do so much effect. And the medicine is normally we don't take, so if we take 1 pill, then the work, because one is abstracted, like the essence, and then second also the body is not used to it, taking this kind of, so then that way they're working. So when we're looking like the heart attack, an example, like that the blood causing, and most time is that the cholesterol stick, then closing the channels, so basically the blood is thicker. So the many people end up like taking aspirin or putting stents in the heart or this kind of. So this kind of time, what we do, we understanding is the cause of this heart attack is the fat in the blood. That is number 1. Number 2, the cause of this fatness is the muscle of the heart is not able to pumping well. So after this, the fat blocked the channel, and that somehow the muscle of the heart became weak. So what we need to do now, we need to do 2 things. First, we try to pure producing the blood, and second, we try to restrain the muscle of the heart. In order to go to make it pure the blood, we need to go down to the digestive system. That thick, fatty blood is coming from the digestive system, through the digestive system. So that way, first we try to increase the digestive system, taking whatever medicine or changing diet, so on and so forth. That helps to producing is the pure blood, and then also melting the fat in the blood vessel. And the second, we try to increase that the muscle of the heart to pumping better the blood, so the blood to circulate is feel better. So for these two reasons, what do? Is we taking some decoctions. Simply is amla, that the amla fruit. That what we call is gyurura. I think that the Hindi name, I think, is they call amla fruit. So we take the decoctions from that the gyurura, gyuruchitan, that the drink that gyurura. Because the gyurura, amla is a sour taste, which means it's a warm nature. As amla, the gyurura has a special like a function, but it's basically normally is warm nature. So it has the power to like reducing the fat in the blood. So we take that the amla fruit juice, sort of like the decoction, about 2 to 3 weeks. And in the meantime, that the amla fruit tea helps to reducing that the melting the fat in the vessel, in the blood vessel. And in the meantime, we take something that the herbs or powder based on the nutmeg. Nutmeg is one of the medicine to help to restrain the heart muscle, and then also helps to restrain all the nerve systems. So these two combined, we try to melting the fat and then try to restrain the heart, so then it's pumping better and the heart function better and the circulation is better. So should go down to the first, we need to touch to the stomach. So the Tibetan medicine is when we're working is sometimes I think the patient feeling is like I told that my problem is hard, but they're treating stomach looks like, looks like as a doctor did not understand what I'm talking about. Then my problem is liver, but they're asking me eyes, looks like. How's your vision looks like? Because we try to find the root of the disease. So first we go to the stomach. Down to the stomach, we try to fixing the digestive system, how they digesting, what you eating, how you have appetite, how's your digestive regulation. So this kind of way, then we try to understanding the cause, whatever. So then based on that, then we try to find that treatment. So as I said, like a nutmeg. So this kind of is like taking that decoction to reducing that fat, and then taking the powder to restrain the heart muscle, and then a special like the nerve system, because it's the pervading lung is located in the heart chakra. We say is kyabji lung ning and then lugu kyabar gyoshin demjo to kyangum chezum chawa pera. So the pervading lung is